we just wanted to explain what Medical Wonders was. It's a student-led and soon nonprofit organization dedicated to educate and advise the students about astounding medical procedures, careers, devices, and more. We have 4 executive teams that help with giving weekly articles and editing articles, and also making graphics for them depending on our medical monthly topic. This month we're doing psychiatry. We have 50 tutors and 10 college overseers. We have 200 members, and we also have a bunch of people on our main board, such as social media designers, Discord managers, and stuff like that, to make sure that all of our social media and communication is going through right. So these are kind of our stats. We have about 300 people involved internationally. We've reached many other nonprofits and kind of collabed with them, and we have 4.3K followers. So we're a pretty big organization, and we're really excited to bring you this Medicine Week. So just to explain what Medicine Week is, we did this last year, and how it usually works is every day this week, a medical professional or student will go on Zoom with us for an hour presentation, introduction, slides, and then a small Q&A section, which you'll be able to ask any questions or anything depending on who's actually presenting that day. For our panel board descriptions, make sure you check out Instagram for them, as we didn't really release them on Google Classroom, just to make it a little simpler. And make sure you also follow us on Instagram, because we'll be also doing a bunch of updates, and make sure you're constantly checking your Google Classroom. Okay, so how do you get your shadowing hours and certificates? So you must have attended 2 or more calls this week, which means that if you attended one, or actually only 1 call or none calls, you're not going to be able to get that certifiable PDF version of your certificate. And the instructions below are for the whole weekend. So you're going to get 2 hours per call per medical professional and or pre-med or med student Zoom call. So that means that if you attend all 5 of them, you're going to get a total of 10 hours worth of verifiable shadowing. And in order to verify your attendance, you must submit a 5 to 6 sentence paragraph of what the caller talked about on Google Classroom. So if you signed up before we closed the form, you should have been invited to Google Classroom and also been emailed the links for the rest of the Medicine Week. And if you fail to join, you cannot get the hours. I can't stress this enough, but you need to be checking Google Classroom for when we officially upload all the YouTube calls, and also the assignments for the 5 to 6 sentence paragraph. If you email us a paragraph, unless you have some like extenuating circumstance or Google Classroom isn't really working, it's not going to count. This is just an easier way for us to kind of manage everything. And it needs to be also in detail. So it's 1 paragraph per call. So there's going to be different assignments on Google Classroom. So you need to find the specific date and just submit each one under the right call. And you need to also put your full name along with the paragraph. So when we give that certificate in about 1 to 2 weeks after the program has ended, your full name will be shown on how you want it to show in that certificate, just so if you need proof for anything in the future. And below, those are bullet points on how to kind of list it on resume and applications. So like I said before, these Zoom calls, even if you've missed them, if you missed day 1 and 2, they're going to be uploaded on our YouTube channel. If you just type in Medical Wonders in the YouTube, you'll see that there are more videos uploaded, and we have a little bit more followers. But definitely subscribe to us, because we are going to be uploading all these medical weekdays, and depending on the order that they're uploaded, they're going to be, it might be completely random. So if you definitely want, your hours and you want to get it from the start, you'll get a notification if you're subscribed to us saying that we've published this. So definitely check that out. And we also have other panels too that we do monthly that we have recordings for. As you can see, these recordings are from last year's medical week that we took a screenshot of. So definitely check those out if you're interested, but you can't get hours for last year's Medicine Week. You can only get it for this year's calls. And yeah, now I'm going to stop sharing, and I'm going to give it over to Dr. Kimberly Pace. Thank you so much for kind of coming on and joining us, and I'll kind of give it to you.
Awesome. Thank you so much for having me. And hi, everyone. So let me get this started. Can you guys see my screen?
Yeah.
Okay, perfect. So like Sonia said, my name is Kimberly Peisch. I'm a pharmacist. I am based out of Michigan. I graduated pharmacy school last year, just completed my residency this year in managed care, which I'll go over a little bit more what that means in the presentation. And I'm now working as a clinical pharmacist at Blue Cross Blue Shield of Michigan. So doing something a little non-traditional, probably not what you expect from your everyday pharmacist, but I'll go over all the different career paths within pharmacy when I start. But this is Pharmacy 101. Just as a disclosure, haven't received any commercial or financial support for this program. And then these are the objectives for what I'll basically be going over today. So starting off with what exactly is a pharmacist, what careers are available within pharmacy, what are the requirements to apply for pharmacy school, what opportunities will you experience if you do go to pharmacy school, and what exactly comes after pharmacy school. So just wanted to start off with some fun facts about who I am. So like I said, my name's Kim. I'm a pharmacist working in Michigan. Just a few fun facts. This is my fiance. He's a family med resident in Michigan as well. We actually just got engaged last year, so I'm planning my wedding right now. And then in addition, I just adopted a cat last year. Her name's Pumpkin, so she's been kind of my support animal throughout the pandemic and throughout residency. So highly recommend getting a cat if you don't have one. And then, like I said, I just finished residency. So that's probably the biggest accomplishment I've ever done in my entire life. So I had to do a photo shoot with my residency certificate. So that's that picture right there. So really quick, just wanted to kind of get a background on who you guys are. Just if you want to, you don't have to say it out loud, but if you want to, you can turn your mic on, or you can put in the chat who you are, like where you're calling from, and like what you know about pharmacy or what careers you're interested in. Oh, that's amazing. You're from Mexico. Hi, Valeria. Thank you. But okay, yeah, feel free to put in the chat whenever, even as I'm presenting, like, where you're from. And then just feel free, if any questions come up, feel free to interrupt, or, you can leave them to the end, or just put them in the chat and I'll make sure to get to them at some point. But hi, Fatima. That's awesome that you're interested in emergency medicine. That's a really cool field. So just wanted to start off with what exactly do pharmacists do? So one of the biggest misconceptions that I think people have about pharmacists is that they pretty much just work in pharmacies dispensing drugs to patients. And that's very, very baseline what we do. There are so many different careers in pharmacy, community pharmacy, which is what your local pharmacists at Walgreens, CVS, Rite Aid, that's what those pharmacists do, but they do a lot more than just dispensing drugs. So you take away anything from this presentation, I hope it's that there's a lot of different careers within pharmacy and a lot of different things that pharmacists do. So pharmacists are medication experts who help promote safety and efficacy of medications. And so they can complete several tasks, such as dispensing prescriptions, verifying dosages and drugs, and counseling patients on medications. But that's kind of the very base of what we do. There's a lot of different things that we can do on top of that. My job, what I do on a day-to-day basis is very different. I talk to patients, but I also talk to providers, and I, make decisions on what medication should be covered under our insurance program. So there's a lot that you can do within pharmacy. So this slide kind of gives a good base understanding of what careers are available within pharmacy. So there's different buckets that you can go into when you're a pharmacist. So these are community or independent pharmacies, which, like I said, are your local CVS, Rite Aid, Walgreens, and then also some of the pharmacists that you may see have their own pharmacies and their own chain of pharmacies that aren't connected to these bigger pharmacies. So those are independent pharmacies. And then hospital pharmacists are pharmacists that work within a hospital. They're usually on the basement, they're rounding with the teams, with the medical team to provide advice about which medications should be given to the patient. Ambulatory care pharmacists usually work outpatient, so they'll work more in clinics and follow a patient longer term, or work with them when they're transitioning out of a hospital or into like a rehab facility. Government federal pharmacy, this is more pharmacists who work at the FDA or the CDC. So they're reviewing, new drug applications that come in and determining, should they be approved or not approved. Managed care pharmacy, that's the field I work in. This is usually pharmacists who work at insurance companies or pharmacy benefit managers, and they kind of decide if medication should be covered under formularies. They work on, quality metric values, so trying to improve patient adherence, things like that. So there's a lot of different things within managed care itself. Long-term care pharmacy, that's kind of working with the patient over a long period of time. So, think nursing homes, things like that. Academia, that's just, working as a professor in school. So, teaching pharmacy students how to be pharmacists. And then finally, the pharmaceutical industry. So there's pharmacists at manufacturing companies like Pfizer, Johnson and Johnson. They're helping to not only make these medications, but also promote them and kind of go talk to other healthcare providers about, what exactly is the benefit of these new drugs that they're creating. So there's a huge, huge field within the pharmaceutical industry for pharmacists. So starting off with community pharmacy, these are pharmacists that work with customers at pharmacies to fill prescriptions, check for drug interactions, and counsel patients. So the benefits of this are that you get a ton of patient interaction. This is kind of the frontline pharmacist who will see the patient, pretty much on a regular basis when they're coming to pick up their medications. And then the hours can be pretty flexible. So you can either work at one pharmacy, so like as the main pharmacy at that pharmacist at that pharmacy, or you can choose to be a floater. So you can kind of staff as needed at different pharmacies. So I know some of my friends right now, they can pick up shifts while they're in residency or while they're working on the weekends, in case they want to do that, just to keep up with community pharmacy and get that patient interaction, especially if they're in a non-traditional setting. And then independent pharmacies, very similar to community pharmacies. They're kind of a subset of these pharmacists. They own one or several local stores rather than working for a large chain. So, usually with these pharmacies, they'll know their patients really, really well and have a really close relationship with them. Most of the patients that go to independent pharmacies have been going there for years. Their grandparents go there, great grandparents. They really, really get to know the community well. So the benefits of going into this career path are that you get a ton of patient interaction, lots of community engagement, and lots of flexibility in practice. A lot of times, because these pharmacists own the pharmacy, they can do specific things for patients. Like they might be able to provide a delivery service for patients that other pharmacies might not be able to. They might be able to do med packaging, especially if they know the patient's prescriptions really, really well. So independent pharmacies are great in that they're really able to customize the patient experience and really go out of their way to make sure that they're giving quality care, which is really nice. The next one is hospital pharmacy. So most of my friends that I know work in hospital pharmacy. It's one of the most common fields, either community or hospital. These pharmacists work directly with other healthcare providers in the hospital to ensure the patient is getting the right medication and dose at the right time. So hospital pharmacists, there's two different subsets you can fall into. You can either be a generalist or you can be a specialist. And so usually generalists, they will work in the basement, kind of looking at all the different medications as their orders that are being put in and just making sure that everything makes sense in terms of the medication that the doctor is requesting, that the dose, the time, the way that they want to administer the medication. Like, for example, should it be IV or oral? And so they really get to work really closely with other healthcare providers, which is really nice. And then specialists usually end up rounding with teams rather than looking at orders as they come in. So what that means is when medical teams are rounding on their patients within the hospital, the pharmacist will actually go with them and then provide their recommendations for what medication they should use for the patient or what dose they might need, things like that. And they're always available if the medical team ever has questions about medications or things like that. And they do help with other things, including insurance and some like social work things that might come up as well in terms of medication. So there's a lot that hospital pharmacists do. And you can really tailor your job to what you're interested in, which is really nice. But specialists do have to get an additional credential added to them. They do have to do residency most of the time. And I'll go over that later on in my PowerPoint. But the benefits of this are that they get to work with other healthcare professionals, and it is a very fast-paced environment. So you're not necessarily doing the same thing every day. A lot of times these patients come and go pretty quickly from the hospital. So you really have to keep up with everything that's going on. Make sure you're, checking the chart and, waiting for labs to come in, things like that. So there's a lot of things to keep on top of, but it is a really exciting field to be in. Ambulatory care pharmacy is a really cool one. Typically, these pharmacists work outpatient and provide care to ambulatory patients transitioning from hospital to home or other care facilities, so something like a rehab facility, for example. What's really cool is that they get to work with other healthcare professionals. They get a ton of patient interaction, and they also get long-term follow-up with the patient. So, whereas in the hospital pharmacy, you'll only see the patient while they're admitted in the hospital, ambulatory care pharmacists will follow up with the patient a little bit longer term. So, something like diabetes management, they'll be checking up consistently what their A1C is, their glucose levels to make sure, no changes need to be made to their insulin or their other medication regimen. So you really get to form a relationship with the patients and really get to monitor them long term, which is really, really nice. Government pharmacy is a really unique aspect of pharmacy. So these pharmacists are employed by local, state, or federal government agencies. And pretty much they review new drug applications as they come in from pharmaceutical manufacturers. And what's really cool is with this field, you get a lot of times get to see all the new drugs right as they're coming in and right as they're being made and approved. And you get to sit in on a lot of really, really cool decisions that are being made. I know when the COVID vaccines were coming out, the FDA was heavily involved in that, especially the pharmacists, because they were reviewing all the new information and studies that that Pfizer and Moderna were submitting to the FDA. So the pharmacists were the ones helping make that decision. So it's a really, really cool field to be in. And then same goes with the CDC. These fields are really great if you're interested in more public health. Just because you won't be working directly with patients, you'll more get to work on a large scale intervention for patients. So, you don't really see the effects of the decision you make directly, but you get to see them on a larger scale, which is really, really nice. And the benefits of this are that it's flexible. There's good opportunity for growth. I did a rotation at the FDA my 4th year of pharmacy school. It was really cool. You get to meet a ton of different people and, just making an impression with one. All of them have basically told me if you're in the FDA, it's really easy to move within the FDA. So if a position opens up that you're interested in, if you know the person who's hiring, it's really easy to kind of move between different fields, which is really cool. And there's a variety of day-to-day tasks that you can do as well. Like I said, you're kind of reviewing new medications as they come through all the time. So you really get to keep up with medicine as it's changing, which is really nice. Next up is managed care pharmacy. So obviously this is my favorite type of pharmacy because this is the field that I'm in. But for this pharmacy, basically what pharmacists do is that they work at insurance companies or pharmacy benefit managers, and they monitor patient safety, develop clinical programs, and manage costs. And so basically on a day-to-day basis, there's a lot of different things that you can do. Prior authorizations, I don't know if any of you guys have heard of that, but basically what they are is if a medication is a little bit more expensive or needs a little bit more monitoring for adverse events, things like that, insurance company can put a prior authorization on it on the medication, and then the doctor has to submit clinical information in order for it to be approved under the patient's insurance plan. And so there's pharmacists who actually review those prior authorizations as they come through and determine if they should be approved or denied. And so that's what I had to do for a lot of residency, was help make those decisions. In addition to this, we have things called P&T committees. So as kind of like the FDA, as new drugs are coming in, we're also making decisions on how they should be covered and if they should be covered by the insurance company. So there's a lot of different things that you need to consider. So more than the FDA, we're also considering costs of the medication. We're considering if it should be covered under their pharmacy benefit or their medical benefit, like where is the drug being administered? Is the patient taking it, or are they getting it from a healthcare provider? So there's a lot of different things that go into it. But it's really cool because like I said, very similar to the FDA, you're learning about all the new medications as they're coming out. You're really keeping up with pharmacy as it's changing day to day, which is really, really nice. So it kind of keeps you on your toes, and it's a really cool field to go in. And then the benefits of this are that it's flexible. Like I said, there's a public health aspect to work, which is what really drew me to managed care. And then your tasks just can vary from day to day. Even if you're in a field that you're set in, a lot of times you'll get pulled to help out with other fields. If something happens within the company, like if a new drug comes out, everyone tries to pitch in as much as they can to help out that team that needs help. So things can change on a day-to-day basis, which I really like. So it definitely keeps things new and fresh, which is really cool. The next type of pharmacy that you can go into is long-term care pharmacy. So for this, you provide medicine and counseling to patients at nursing homes, assisted living facilities, group homes, and rehab. And so this is usually these pharmacists usually will work within these facilities and kind of provide medications and counseling to these patients. So it's kind of like a community pharmacist, but within a long-term care facility, if that makes sense. And then the benefits of this, very flexible hours. You have the opportunity to travel as well, depending on, if you need to deliver medications to other patients, and then a variety of day-to-day tasks as they come up for the patients. And the patient demographic that these providers can work with can range from elderly patients to HIV patients, or even patients with developmental challenges. So there's a lot of different subsets that you can go into within long-term care pharmacy. The next one up is academia. So for this, this is usually if you want to work in an academic setting. So you help train pharmacy students and conduct research. So a lot of my professors at pharmacy school, they were also doing research on the side, which was really cool. And they're usually really great about having students be involved as well. So I got a number of publications when I was in pharmacy school. So there's definitely an opportunity for that while you're in pharmacy school. And the benefits of this are that you get to interact with students. It's pretty flexible. You can kind of teach which classes you want to teach, depending on what you specialize in as well. And then there's good opportunity for growth. You know, you can get promoted to an assistant professor, clinical faculty, things like that. So there's really opportunity for growth rather than staying in the same position that you're in long term. And then finally, the last field that I wanted to talk about was the pharmaceutical industry. So this one's really cool in that these pharmacists help develop new therapies, keep drug labeling accurate, and help companies comply with federal and state laws. So like I said, you know, these pharmacists are working in research and development. They're working to, you know, promote their drug to insurance companies, to healthcare providers, kind of go over the benefits of the drugs and really show them why, you know, these drugs should be covered by them and what that benefit is. And so it's really cool because, like I said, this is very public health oriented as well. You're kind of on the forefront of medicine as it's changing. You know, you're right there where they're making the new therapies, which is really, really cool. And I have a number of friends that are in this field. Some are at Johnson and Johnson, some are at Pfizer. So it's really cool to see, you know, people you know working on new therapies that are coming out. And so the benefits of this, it's very flexible. There's also the opportunity to travel. You know, a lot of pharmacists that I know who do, they have to travel, you know, they'll have like a section of America that they're in charge of to kind of do these presentations for, and they'll get to travel around to, you know, come and present in person to companies or healthcare providers. So there's that really cool opportunity. And then you just have a variety of day-to-day tasks. You know, things can change on a daily basis. Very similar to managed care. It's kind of like all hands on deck at the company, depending on what's going on at the company. So there's a lot of different things that you can do and try out within the pharmaceutical industry. So how do you go about applying to pharmacy school? So the application process is pretty straightforward. It goes through PharmCast, which is the Pharmacy College Application Service. And most pharmacy schools in the US participate in this application. It's kind of like a common app. I think when I applied, I don't think there were many schools that were outside of this. So for the most part, you should be applying through this application. And then the applications and materials you submit to PharmCast will go through a verification process before being transmitted to whichever programs you select. And so there's a couple of prerequisites for pharmacy. These include general and organic chemistry, biology and microbiology, physics and calculus, anatomy and phys, psych and statistics, and then depending on which school you apply to, there also may be an English and or public speaking requirement that you have to do. So I know some of the pharmacy schools that I applied to had a public speaking requirement that you had to do. So I ended up having to take that elective in order to apply. And then the exam that you'll be taking is the PCAT. So it's similar to the MCAT, but a little different. This is a standardized exam required by most pharmacy schools that measures general academic ability and scientific knowledge. And it's 220 minutes administered through Pearson, and it's just, you take it on a computer, like I said, very similar to the MCAT. So for the sections of the PCAT, there are 5 of them. The first one is writing. So you'll just have one writing prompt where you'll write an essay for that. Next section is biology. 50% is general biology, 20% microbio, and then 30% is anatomy and phys. You will learn a lot of anatomy and phys in pharmacy school. We have a class specifically dedicated to that basically, but in terms of medications, like how the medications work in the body. So if that's something you're interested in, pharmacy school might be a good option for you. I know that was something I was interested in. So, and then the next section is chemistry. So 50% of this is Gen Chem, 30% is Orgo, and then 20% is Biochem. Then there is a critical reading section. 30% is comprehension, 40% analysis, and 30% evaluation. When I took the PCAT, I think it was just kind of more vocab based, but I think they may have changed it a little bit. And then the last section is quantitative reasoning. So this kind of is more like the math section. So 50% general math and algebra, 18% stats, 18% pre-calc, and then 14% calculus. And then there's a couple of other factors that schools will take into account when you do apply to pharmacy school other than your PCAT. So that'll be GPA and class rank, volunteering, work, and shadow experience, your letters of recommendation, and then also a component of it is if you're in state versus out of state. So just things to keep in mind, just because you may be lacking in one of these, just remember there's a ton of different things that they take into account. So don't feel disheartened if, you don't have as much experience or your GPA may not be as high as like the next person. There's always things that you can do to show your passion. So that's just what's most important when applying to pharmacy school. And then finally, if you do submit your application, there's a chance that you might get an interview to pharmacy school. And interview formats vary from school to school. They can be conducted by a single faculty member, a student, a pharmacist, or a panel of interviewers. And I had all of those during my pharmacy school interviews. And then in addition to this, they can include a tour of the facility and or campus and an opportunity to actually sit in class with students to just kind of see what a day in pharmacy school would look like. And then interview questions, there's a number of them that you may get. So general questions such as, why do you want to do pharmacy? What are your interests? What do you want to do? What are your strengths, weaknesses, things like that. Then experience questions. So, have you shadowed before? Have you worked before? Things like that. Pharmacy school loves situational questions. So even for medical school, if that's what you're interested in, I would definitely prepare for these. So for these, they'll kind of give you a situation and kind of ask you, hey, if you were put in this scenario, what would you do? I think there was one, it was like that I had during my interview, if I saw someone cheating next to me, would I report them? Would I not report them? What would you do? And so the point of these questions is to really gauge your thinking process through them. It's not really to, there's not really a right or wrong answer. It's really to understand, who you are as a person and what you would really think about when confronted with that situation. So those are really important no matter what healthcare field you go into to prepare for, because they can be tricky and they can be, sometimes they catch you out of nowhere. So they're good to just have a good baseline understanding of and a good baseline answer for. And then you'll definitely get some fun questions. I know in my residency interview, I got a question of if I could be any brand, what brand I would be. And so, those you can't really prepare for, but I think, if you just are honest, about what, your personality and things like that, that's the most important thing that shines through in an interview. And then the last thing that you may get in these interviews is a group interview or a writing prompt. I know when I was in pharmacy school, or when I was applying, one of the pharmacy schools had us write a prompt. I think it was like we got 30 minutes and then we had to respond to a prompt about something. And then I also had a group interview as well, where we were asked a question. It was kind of more a conversation format, but the most important thing was, to talk through it and give the other people in your group the opportunity to talk as well. So that was really unique part of the pharmacy school interview process. So what will you learn if you do go to pharmacy school? So there are a number of different classes that you'll take, but the most common ones that you'll probably get across the board are Pharm Sci, Med Chem, and Therapeutics. So Pharm Sci focuses on drug discovery, design, delivery, and action. So this is a lot of physics, math, kind of just really understanding how the drug will be delivered to the body. And then Med Chem focuses more on the chemistry behind drug development. And how the drug will work within the body. So for this, it's a lot of orgo, it's a lot of chemistry, it's a lot of just understanding the mechanism of action, what will happen when the drug gets into the body, why is it working the way it is, things like that. And then therapeutics focuses more on the appropriate use of drugs, choosing the right drug for the right disease state, understanding if there are any contraindications to certain medications and interactions, the method of administration for these drugs, and the right dose that's required. So this is a lot more, application based, whereas MedChem is a lot more just understanding the theory behind these medications. And then in your first year of pharmacy school, in addition to these three, you'll also probably get an intro to pharmacy. So these are just general classes that you'll have to explore the various fields within pharmacy. So a lot of the ones that I highlighted earlier in the slide, they'll probably go over that and kind of explain, these are the different fields that you can check out. P2 year is structured very similar to P1 year, but the only change is instead of those intro classes, you'll start your rotations this year. So usually in your second year, you're doing your community pharmacy or ambulatory care rotations. So usually like once or twice a week, you'll be going on site. I had a rotation at Sam's Club Pharmacy that I did once a week, and you'll just be working there for the day as basically a pharmacy intern and kind of helping out with patients as they come in with day-to-day tasks. P3 year, very similar to P2 year, getting more of that pharmacy med chem therapeutics. And then this is the year that for your rotation, you'll be getting the hospital pharmacy experience. So going in once or twice a week to the hospital and working there. And then in addition, there's usually an evidence-based medicine course where you learn a lot of biostats, you learn how to, read and interpret clinical trials, things like that. So that was one of my favorite classes, which is why, it made sense to go into managed care, but it's very diverse curriculum that you'll get. And then P4 year, you actually don't have any classes at all. It's all rotations throughout the year. So there's a number of different ones that you can have. You can really structure your schedule to what you're interested in. So these include community, hospital, health system, and then your electives. So my P4 year, I did electives at the FDA, like I said. I did one at Procter & Gamble because I wanted the industry experience. And then I did one at a managed care company because I wanted to have that before applying to residency. And then what comes after pharmacy school? So what's nice about pharmacy is that actually after you graduate pharmacy school, you have your Doctor of Pharmacy degree. And so you can start working right away after pharmacy school. And with this degree, you can either work, like I said, as a pharmacist, or you can pursue further education through a residency or a fellowship. And so if you do a residency, usually your first year of residency will be your PGY1. So this will be a 12-month postgraduate curriculum that offers training opportunities in acute care, ambulatory care, drug info and drug use policy development, clinical services, and practice leadership. So this is usually what you'll get if you go into a hospital pharmacy residency. This is like the typical thing that you'll get. And then in addition to this, if you want, after you're done with your PGY1 residency, which is just a general residency, you can do your PGY2 residency and specialize into a certain field. So a PGY2 will build upon the competencies developed through a PGY1 in order to prepare for board certification. So usually pharmacists will only do this if they want to specialize into a field. So let's say you want to be like a psych pharmacist or a pediatric pharmacist. You would do a PGY2 in that specific field, and then you would take your exam after your PGY2 and then get a certificate that basically says, I'm board certified to be a specialist in this field. And that's how a lot of times that'll be a requirement for those specialist positions, just because they need someone who has done that extra year of training to really understand, the medications and the dosages for that patient population, because they can be so different from field to field. And then you can also do a managed care residency, which is what I did. This is a PGY1 managed care residency, enhances general competencies in managing medication use systems and supports optimal medication therapy outcomes for patients with a broad range of disease states. So what that means, basically, I rotated through like the different pharmacy fields available within managed care pharmacy. So like I said, I worked on prior authorizations. I worked on the formulary team. I did presentations for the P&T committee, gave my recommendations on if we should cover or deny medications as they were, approved through the FDA. Worked on the medical side of things, doing medical approvals and denials, things like that. And then also did medication reviews with patients. We also offered that service through Blue Cross Blue Shield of Michigan. So I had to call patients, look up all their medications, do a thorough med review for them, and a lot of times have to reach out to the provider if there were any interactions or issues with the dose that I saw to make sure that they were getting optimal therapy. And then finally, the last thing that you can do is a fellowship. So this is mainly what you would do if you were interested in going into the pharmaceutical industry. And the best way I can explain this is it's kind of like cramming in 3 to 5 years of work experience into 1 to 2 years. So when you're done with your fellowship, you kind of get hired at a higher level than you would get if you're just going straight into pharma, basically. And so this is a directed, highly individualized postgraduate program designed to gain experience in various departments within the pharmaceutical industry. And this can be 1 to 2 years in length, depending on what field you're going into within pharma. But it's very, very individualized. They only take, usually each company only takes 1 to 2 fellows per year. So these are very, very competitive. But like I said, it's also a great way of getting a ton of experience in a shorter period of time so that you can move quicker up the ranks when you're hired on. And then I just wanted to wrap up by kind of giving you guys an overview of what my career path looked like. And so I know you guys are probably in a position right now where you're probably stressed about what you're going to do. I know this presentation was probably overwhelming. It can be daunting going into, going into the healthcare and just kind of understanding, what is required, especially if your heart's not in it, if you're going down the right path. And so for me, what happened is that I was actually pre-med for a number of years up until my actually senior year of undergrad. I had taken the MCAT. I was getting ready to apply to medical school. And then when I was right at the end, I just felt like my heart wasn't in it. I had done a ton of shadowing and something just felt off. And so I decided to take a year off after undergrad and kind of really, just understand what I wanted to do and kind of give myself the opportunity to explore different career paths before fully committing to medicine. And pharmacy had been something that I had been thinking about for a really, really long time. And so, I decided to, during my year off, get a job at CVS, do a ton of pharmacy shadowing. And I kind of fell in love with it. And, I took my PCAT during my year off, applied to pharmacy school, got in, and was able to really put my heart and soul into pharmacy school when I got into there. And then even within pharmacy school, I went in thinking that I was going to be a hospital pharmacist. And when I started shadowing hospital pharmacists, I realized that I wanted more of a public health aspect in my future career. And so I started exploring the different career paths within pharmacy. And, like I said, I did a ton of different rotations just to get as much experience as possible, and really felt like my niche was in managed care. And today I'm so grateful that I did explore all those options because I feel like I appreciate my job and what I do on a day-to-day basis so much more because I know what other opportunities are available out there. And I know that I've done my best to research them and, really see what else is out there. So definitely, if you guys are thinking, even have an inkling of doubt about whatever career you're in, I would just really encourage you to explore what else is out there. You know, there's a ton of different healthcare careers that are available. And so, you know, just really, really encourage you to just explore. You know, shadowing doesn't hurt at all. You know, you can even go for a day to the hospital or to your local pharmacy and just ask if you can shadow and really get that experience, to say at the end of the day that you tried everything that's out there and you really are confident in your decision. But yeah, that I think concludes my presentation, but I just wanted to end off by showing you guys there's, at the end of my presentation, there's some resources I highly recommend if you're interested in learning more about pharmacy and pharmacy school. Pharmacyforme.org does a really good job of like kind of summarizing what the different careers in pharmacy are. PharmCast is where you'll apply to pharmacy school, and then AACP and ASHP are the main pharmacy organizations. And so they put on a lot of really cool presentations and really cool speakers come. So you can get a really good understanding of, you know, different career paths in pharmacy, different specialties, things like that. And then just wanted to shout out Medical Wonders. Thank you so much for having me today. I appreciate getting the platform to speak about pharmacy. But with that, what questions do you guys have?
While everyone's waiting to, I guess, type questions, I can ask one like final question. Knowing that our audience is either in mostly early high school, or in college, what would you recommend if they're definitely interested in pharmacy for them to do, I guess?
Yeah, so I think one of the best things that you can do when you're in high school is just volunteering. Just getting those volunteer hours is really important. So like volunteering at the hospital, things like that. Also, while you're in high school, you can also do shadowing. You know, you don't really need a degree or anything like that in order to shadow a pharmacist at the hospital, or even at your local community pharmacy. And then I know a lot of pharmacies, I'm not sure, but I think that they'll take a high school diploma if you're interested in working as a pharmacy technician at your local pharmacy. And I highly encourage like anyone who goes into pharmacy to work as a pharm tech, just because you get really comfortable with the medications before you go into pharmacy school, which really kind of gives you a leg up on studying and things like that. So we definitely recommend those things. Okay, so questions. Did I have to get a bachelor's before pharmacy? So I did, but not everyone in my class did. I mainly did because I decided to go into pharmacy after I graduated college. But some pharmacy schools actually offer, I think, 6 or 7 year programs. So what you can do is do like a direct program. So one of my friends that went to U of M with me, she applied to pharmacy school her sophomore year, I believe. And so she did a 6-year program. So I think she did 2 years of undergrad and then 4 years of pharmacy school. So I know they offer 6 to 7 year programs at certain schools. So if that's something you're interested in, like if you know you want to do pharmacy, yeah, I definitely encourage that because you get that undergrad experience, but you still get pharmacy school. What are some aspects of pharmacy and medicine that are similar and some that differ? So yep, that's a great question. So pharmacy and medicine are pretty similar. Like I said, I was lucky because I was pre-med before, so a lot of the requirements for pharmacy school and med school overlapped with one another. I think the biggest difference is that with pharmacy, you're more focused on the medications rather than diagnosing and things like that. A lot of times, like in our exams and things like that, we would already have the diagnosis made available to us, and then we would just be deciding on which medications to give, what dose to give. So I think that's the biggest thing. You're not really diagnosing as much, but I do know pharmacists who have been working in their careers for many years who are able to, read EKGs and, make diagnoses. So that comes with experience as well. But I think that's the biggest difference. We focus way more on like the treatment aspect of things, whereas I feel like doctors focus a lot more on just the diagnosis and understanding holistically what's going on with the patient. How did I prepare for the PCAT? So I took a course right before. I think it was an online course. I didn't do the in-person course, but they do offer some through Kaplan. I don't remember the specific course I took, but I basically just had a book. I went through it, did a ton of practice exams right before my exam. So I would highly encourage that, both for the MCAT and the PCAT, depending on what you decide to go into, to just take practice exams, because that's the best way you'll understand where you are going into that exam. Just because like doing just questions on your phone casually, it's not the same environment as like when you're sitting there for hours taking the exam. So that was probably one of the best things that I did right before I took my PCAT. How did I decide to go into managed care residency instead of going into general pharmacy? So yeah, great question. So I, going into pharmacy school, had already shadowed a ton in hospital pharmacy. Like I said, I took my year off, so I had a lot of time to really go into the hospital and shadow pharmacists to really try and figure out what I wanted to do when I got into pharmacy school. And one of the biggest things that always struck me was that I was really interested in the public health aspect of a job. And so that was one of the things that I realized managed care could offer. I went back and forth a lot between industry and managed care, and FDA, like working in government pharmacy, just because those three really give you that public health perspective. But I was actually lucky enough to get an internship after my second year of pharmacy school at Blue Cross Blue Shield of Michigan, on the commercial side. And so I got that experience, just absolutely loved what I was doing on a day-to-day basis. And then when it came up time to apply to residency, I was really interested in geriatrics as well. And so I ended up getting, my residency is focused in Medicare patients, and I work with Medicare patients right now. So it was like a perfect combo of the two. So that worked out great. Do you feel like it's difficult to implement a good work-life balance as a pharmacist? So definitely during residency, my answer would have been yes. Residency is just one of those times you just don't have a life pretty much. I think what was tough is that, like I said, my fiance, he's going through his medical residency right now. So that was a little tough on both of us, just both of us being in residency on a day-to-day basis. Once you're done with residency though, like I feel like I have a pretty good work-life balance. I think it's all about just like, you really have to train yourself to just like shut your laptop off and just like give a few hours to yourself, because it's really easy, like no matter what field you go into, to just always be thinking about work all the time and your patients. But I think just for your own mental well-being, like you also just need to take that time for yourself. So I think pharmacy has a great work-life balance, especially like depending on what field you go into, it can be pretty flexible with your hours. Yeah, I think I think compared to medicine also, I think it also probably has a better work-life balance. But and then, do you have any tips on how to excel on IPPI and APPI rotations? So I think the best advice I can give is just to, make sure you make a good impression to whoever you meet. One of the things that you'll hear if you ever go into pharmacy school is that pharmacy is a very small world, so everyone knows everyone. So just be really mindful of how you treat others. Even if you don't get along with one of your preceptors, just be respectful to them. And then, make the most out of your rotation. Even if you're hating it, there's still things that you can do within that rotation that you can tailor it to your interests. When I was on my health systems rotation, I decided to take on a research project to understand the utilization of the medications that they were using, which was way more managed care focused than hospital focused. And so, my preceptor was really impressed, that I was like taking that initiative to go out of my way to really make the most out of, my rotation, even though she knew that wasn't the field I wanted to go into. And she actually gave me the opportunity to present to the department my findings. So just make the most of whatever experience you get, like I said, you can always find something that interests you no matter where you are.
Yes, so we're gonna end it here. We're right on time, but if you have any questions, Dr. Pace, if you want to leave your like Instagram or anything like that in the chat, we just wanted to say on behalf of Medical Wonders, thank you so much for coming on. We usually don't cover pharmacy. It's definitely, I guess, a little less talked about than medicine, but we're really excited to have a pharmacist actually come on and talk about the whole process and stuff. And I definitely learned a lot, and I'm sure a lot of people learned more about the pharmacy side. So thank you so much for coming on. If you guys have any questions, make sure you thank Dr. Pace for it. And if you guys have any questions, just email us on medical.wonders with 2 S's at gmail.com, or you can just find us on Instagram at medical.wonders with no extra S. But thank you so much. And if you have any last minute words or anything like that, you can say it. But otherwise, yeah, we're gonna end it here.
Yep, I don't have much to say, but yeah, I posted my Instagram in the chat. So if anyone has any further questions, just feel free to DM me, or my email is here. You can shoot me an email. But thank you all for joining today, and I hope you learned a little bit about pharmacy.
Yep. Stay tuned for tomorrow. We're gonna have another medical professional come on. So yeah, thank you guys so much. Bye.
Bye.